Welcome to the Health and Government Operations Committee voting session on our voting list number 7. I think we will begin by asking, is there a motion to allow sponsors to withdraw the bills? I guess I'll read the numbers: 177, 308, 614, 627, 643, 790, 961, 1006, 1008, 1009, 1074, 1161, 1266, 1275, and 1347.
I move to withdraw the bills.
Second.
Is there any discussion? All those in favor say aye. All those opposed, no. Please raise your hands, and I'm opening my participant list so I see you guys. Okay, I see a hand, Delegate Kelly.
Yes, not in opposition to the withdrawals, fully support the withdrawals. Just, I know several members have asked me about this, so I want to make sure the committee is aware that my bill for registered behavioral technicians for children with autism treatment, I'm withdrawing that because the Department of Health has worked that out with us, and they've found a way to ensure that those caregivers, those folks who are working with children with autism are going to be able to stay in the workforce and give those kids the services that they need. So I thank the Department of Health for working with me on that.
Nice to know that they worked with you on that and you came to a good solution. Thank you for your efforts. With that, all those in favor, aye. All those opposed, no. Hands raised, and I see no hands, so we'll allow the sponsors to withdraw those bills. House Bill 370, Erin.
House Bill 370 requires the Secretary of Health to issue a new birth certificate for an individual if MDH receives satisfactory proof that the parent listed on the original birth certificate has undergone a sex change or has an intersex condition. The new birth certificate issued may not be marked as amended or show that a change has been made to a sex designation or, if applicable, to a name. There is a reprint of the bill on pages 1 through 8 of your packet. There is an amendment on page 2, lines 14 through 23. And this amendment would retain the current law that requires a licensed healthcare practitioner to determine that an individual's sex designation should be changed because the individual has undergone treatment appropriate for the purpose of sex transition in order to make a new certificate of birth for the individual.
Delegate Peña-Melnick.
Thank you, Chairman, and thank you, Erin, and the committee. You know, this bill basically shifts the requirement from the medical provider to the individual themselves to attest to their gender identity under the penalty of perjury. This actually puts it in the same view and line as what we did in 2019, where we allowed individuals to do this when getting a driver's license. And we did that in 2019 in House Bill 421, where they're able to do the self-certification. We did take a vote in subcommittee. It was not unanimous, it was party line, but we have since amended the bill as Erin stated.
So Delegate Peña-Melnick, does the bill now refer only to parents certifying for their change in sex, gender, and leave the child's process the way it is in state law today?
That is correct.
Okay, thank you.
My pleasure. Thank you.
Okay.
I move the amendment.
Second.
Discussion? All those in favor say aye. All those opposed, please raise your hand. I see this is the amendment we're voting on that puts it back to the original language. Just want to make sure you understand what you're voting on here. I would think that the amendment would be unanimous, and it is. The vote is unanimous for the amendment. Delegate Peña-Melnick?
I move the bill as amended.
Second.
Is there discussion on the bill as amended? All those in favor say aye.
There's a discussion from Delegate Belcastro.
Oh, I see. And then Delegate Morgan. Okay, start with Delegate Belcastro, please.
And I'm really sorry to do this because now I'm feeling really confused. It was my understanding that we were removing self-attestation for children. Is that not what I heard something very different, I think, from Aaron. Can you give me some clarity, Aaron?
It removes the self-attestation when you're changing the name of the person on the birth certificate. So your birth certificate, it retains the self-attestation if it's the parent changing the parent's name on the child's birth certificate.
Okay. All right. Thank you.
Is what we discussed yesterday. Okay. Okay.
Delegate, I see no hands now. Delegate Morgan, did that answer your question?
I was just trying to vote.
I was just trying to vote.
Oh, okay. I just want to make sure I'm interpreting hands correctly and giving everyone a chance to understand what we've done. All those in favor? I presume we seconded this? Yes, we did. And then we just,
Yes.
all those in favor say aye. All those opposed, say, please raise your hand in the panel. I see Delegate Kipke, Delegate Riley, Delegate Krebs, Delegate Morgan, Delegate Shalega, Delegate Chisholm, Delegate Saab. Did I miss anyone who wanted to be registered? No. Richard, do you have, okay, you have 7 names on your list, correct? Okay. Thank you very much. The bill passes and you will be correctly recorded with your vote. House Bill 413. Lisa.
This administration bill extends the existing state health insurance provider fee assessment through calendar year 2028 to assist in the continued stabilization of the individual health insurance market. There are amendments on page 9 of the packet that make technical changes. They establish a credit for standalone dental and vision plans. They provide that funds from the distribution of the assessment may only be used for certain purposes. And they require the Maryland Insurance Administration in consultation with the Maryland Health Benefit Exchange and the Maryland Healthcare Commission to submit a report to the governor and the General Assembly on the impact of the state reinsurance program.
Lisa, sorry, Delegate Cullison.
That would be mine, Madam Chair.
Yes, I know.
Right.
You were
So,
covered on this.
Very briefly, 4 years ago, we instituted this provider fee where our insurance carriers and its universal insurance carriers in the fully insured market that include both the individual market and the small group market and the MCOs have been paying a fee into a reinsurance fund. And the reason for that was because our individual market was dying. It was our average premium increases were anywhere between 30 and 50%. And we were really worried that our body was worried that we were going to lose our individual market, because what was happening was the young, healthy people were dropping their health insurance. So the folks who were in the health insurance market were sicker. The reinsurance program was designed to address that issue and stabilize the market, which it ultimately did. And we have effectively decreased premiums because of the existence of the reinsurance fund in the last 3 years. The administration wants to make sure that we have the funds needed moving forward past the sunset of 2023 to ensure that the fund will be viable and be sustained for the next 5 years. the request, we are able to do this because we have a waiver from the federal government in order to do it. And that waiver needs to be renewed next year. But in order to renew it, there's a lot of information that has to go into that waiver. And the Maryland Health Benefit Exchange and the Maryland Insurance Administration were saying to us that they need this time to gather that information, develop the waiver, and have all the data that the Centers for Medicaid and Medicare need in order to approve the data. So that is why the bill is before us. We tried to address some of the issues that were raised by the carriers. And one of them was the standalone dental and vision programs, insurance programs cannot benefit from the reinsurance program, while all of the other insurance companies can, because they can tap into the fund. So because we need them to be in order to meet the requirement that it is a broad-based fee, in order to include our MCOs, our managed care organizations, which are run by Medicaid. We have to include them in the waiver, but we're providing them with a credit that's equal to the amount that they give us in order to make sure that they are whole and not contributing to something that they cannot benefit from. In addition, the carriers were looking at, were there other options for ways to pay for this fund, and asked us to do that. We're under a little bit of a time crunch now in terms of getting the waiver prepared for next year. So this bill does not preclude that kind of gathering that kind of information, doing that kind of analysis. In fact, it requires a study to consider other options and bring them back to us for consideration. So we were able to bring that in as well. The committee, debated this issue. It was not unanimous, but we did pass this bill out of the Insurance and Pharmaceutical Subcommittee. And I think I'm open for questions, Madam Chair. Perhaps I can move the amendments and then we can have discussion.
Is there a second?
Okay.
Do I hear a second?
Second.
Thank you. Is there discussion on this bill? Delegate Morgan.
Thank you, Madam Chair. Delegate Collison, I can't remember if in subcommittee we talked about this, but it did pop in my head, so maybe prep for the floor. Do you know what the rates were in, I believe we established this in 2018 in the individual market versus now? Have rates gone up since 2018? What is the spread there?
You mean premium rates?
Yes.
They've gone down 32%.
32%.
Right, in the 3 years we've had the program. And so there are many more well people in the pool than there were in 2018. Now,
do we know what the rates have gone up in small group, large group because of the tax?
So it is the right of the carriers to pass that tax along. It is 1%. So it would be 1% of the premium that you're paying. So I'm not a mathematician, but if my premium is $400 a month, it would be 1% of that, which I think is like $4 a month. So yes, it does impact that.
Is it 1% on the rate holder or 1% on the?
It's 1% on the insurance carrier, but they have the right to pass that along to consumers if they so choose, but that is up to them.
Okay, gotcha. Thank you.
I see Delegate Krebs followed by Delegate Saab.
I don't want to disappoint Bonnie and not repeat myself again, but for the sake, hold your ears, but just for the sake of the committee, as she said, this is something we did 5 years ago, and it was sort of a temporary Band-Aid until we found a better way and to boost the market up. It's supposed to be temporary. It has been 5 years. I think we voted for it the first year. We didn't vote for it, the extension, but My issue with this is just the fact that we're extending it for 5 more years and we haven't done the study. And I believed that when we left last year, that there was something set in place to do the study, and they were supposed to get back to us about an alternative funding source. As was mentioned in the committee, in the last 5 years, $1 billion worth of fees, or whatever you want to call them, tax fees, has been put on one segment of the insurance industry, which is the fully insured. It's 17% of the market. The Medicaid part is a wash because taxpayers are paying for it anyways. We won't talk about the Medicaid, but $1 billion has been paid to stabilize the market. And everyone's proud of us bringing the rates down 32%. We could bring the rates down 100% and make it free if we subsidize the rest of it. So, bringing the rates down by artificially subsidizing to me is not boosting the market up, but that's just my opinion. If we do this for 5 more years, the estimate that the insurance companies gave us is $5 billion would be coming from one segment of the market to subsidize another segment of the market. I just think that the philosophy behind who we're taxing one segment to pay for another segment is not the best policy. And I would have liked to have seen us find the alternative funding source for that before we passed it for another 5 years. So that's why I'm voting against it. I'm disappointed we weren't able to do that this year. And we're going to pass the bill for 5 years and then study it. I just think it's backwards, but that's my spiel. I lost this argument, but I'm voting no because of that. And I don't think it's fair to the segment that we're continuing to tax.
Madam Chair, may I respond?
You may.
I truly respect Delegate Krebs' opinion and, understand where she's coming from. I would only differ on the fact that all Marylanders benefit when our individual market is stabilized and we can get more people in health insurance when that market is more affordable and stabilized. So while yes, as you said, it's 17% is that small group market. I mean, the individual and small group market, and 33% is Medicaid. That portion is being paid, and all of the residents of Maryland are ultimately benefiting from that. So that would be my response.
Delegate Cullison, would you expand on why all residents of Maryland and people who pay for health insurance benefit from more people being insured?
Sure. When people don't have insurance and they need medical care, the state ends up paying for that medical care. And generally they end up paying for the most expensive medical care in insurance and in emergency rooms. So it's the goal of folks to have insurance to be to participate in preventive medicine and do things that will keep them healthy. And so there's not a lot of burden on the state to pay for folks who are not insured. And we've decreased our uninsured numbers by more than 50% over the last few years. So that is helping the market to stabilize, keeping people healthier.
I just have one more quick question.
No, you are not recognized, Delegate Krebs. Not yet. Let me get.
It has to do with an amendment. That's okay. Just want to make sure you got both amendments.
Just wait, please.
Okay.
Delegate Cullison, when a person is admitted to the hospital and can't pay the bill, does that impact hospital rates, which are then paid by all ratepayers of all insurance policies?
Yes. It's not just in emergency rooms, but yes, hospital care as well.
Yes. Okay. So thank you. I have people ahead of you, Delegate Krebs. You had one bite at the apple. I'll come back to you when I call on all the people who are in line. Are you finished? Who was that I had called on last? Who was that? Who asked the question?
It was Delegate Krebs. So you were going to go to, I think, Delegate Saab.
Okay.
Yeah. Thank you, Madam Chairman. So I think just to clarify the question, so the insurance company said that the member will pay for this. Is it different? Because I asked the question in subcommittee, I don't know if you remember, and they said that this fee is passed down to the insurer, they're not eating the cost.
That's
Just
correct.
just to clarify, because I
Yes.
thought you mentioned earlier that they have the discretion to pass it down, but,
They do have the discretion. They have chosen to do it.
okay, thank you. Just want to clarify.
Thank you, Delegate Saab. Delegate Shaleka.
Thank you, Madam Chair. I would just like to point out that I understand the uninsured, and I was on this small group market, before I got this job where I get this amazing state of Maryland health insurance. I was on the small group market and I had a business, we have a business and we had our employees on there. And this is going to create underinsured people because the cost of the insurance on that market is so terribly high with the deductible of $5,000 and $6,000. I just agree with Delegate Krebs and Delegate Morgan. These are the wrong people to increase fees on. These are the people that work for themselves or have a small business with, a handful of employees that they're trying to insure, and they can't afford it. And we're strapping them with a cost that will make them underinsured.
And I would suggest, Madam Chair, may I?
Yes.
We have seen in the stabilization of the individual market, sort of a shift with the small group market. And I do know that's something that we are looking at going forward in terms of how to make sure that small group market stays stable. But in terms of the amount of cost on the small group market, they pay around $15 to $16 million a year comes from the small group market, folks. And that's out of a $124 million total. So, I mean, I'm not saying it's insignificant, but again, it's contributing to the ability for the market to be stabilized in general. And we are watching the small group market.
Are you done, Delegate Shaleka, or do you have a follow-up?
I'm done. Thank you.
Delegate Krebs, do you have another question?
Yeah, I wanted to make sure we approve both. There's two amendments. One was on page 12. And it's just to remove some of the sponsors that had inadvertently signed up on the bill. They wanted to make sure they got their names off of it.
Yeah, I think we usually vote on one set of amendments first.
Oh, so okay, just want to make sure I had them both in my packet. Thank
And
you.
Which amendment are we voting on? The tax credit amendment first? Okay.
Well, I think we just adopted the amendments. I didn't know we did both.
Right, but I don't think we voted on the amendment.
We haven't voted yet. We've just.
Okay. Thank you.
But we will. Thank you, Delegate Krebs. Just for your information, I have been advocating for years the concept of merging the individual and the small group market. Some of you may know that, some of you may not. I think that that's an issue that we're going to be looking at in the future. And I'm not convinced that I will be a part of that because I will not be long-term involved in these issues. On the other hand, it also may not be a wise thing to do. And I don't know the pros and cons yet, but I'm hoping to start looking at it in the near future, but certainly not during session. And if that is something that needs to be dealt with, there will be the possibility to look at that more seriously in the next term for those of you who return. So I do want to say that the issue does exist. This is not a perfect solution, but I believe that the match of the federal portion of Medicaid money is rather large. Do you happen to know what that is, Delegate Cullison, that brings in the match? Not only is it federal money to begin with, but then it's matched by the reinsurance money. Could you explain that?
Sure. So it's not actually a match. It's what's called a pass-through. And the folks on who buy the on the exchange, for anyone who buys, they may be, because of their income, they're available for an advanced premium tax credit.
That's
And
not
so,
actually what I'm talking about.
but that's what is brings the pass-through money
Oh,
in.
Okay,
And so what happens is the pass-through, the match is pegged to the cost of the second lowest. Found out, Lisa, it's the second lowest silver plan. So whatever those individuals, whatever the feds do not have to pay to those individuals because the premiums are low enough, they are now giving to us, giving to the state. So for example, in 2019, the federal pass-through money was 373 million. And we collected from our insurers in that year was 2.75%. And we collected 326 million. So we got 373 from the feds, 326 from our assessment fee. In 2020, the federal pass-through dollars went up to 447 million. And that's because we had more people in the market. So now more people are getting the insurance, but they're not paying as much because our premiums are down and the federal dollars are coming to us and going into the reinsurance fund. And that year we decreased the assessment fee on our insurers to 1% and raised 118 million on from them that year. And then we don't know the 2021 numbers right now, but we are benefit from the passage of the American Rescue RPA, I forget what the P stands for, Act. So there were additional funds that went into that fund for this year. So we got more than we expected. The issue and the reason for doing this bill now is the federal pass-through funds are unreliable. We don't know how long they'll last. And because we now have an even lower cost silver premium because United came into the market, we actually get less pass-through dollars because they're saving less money because we have more people in the market. So we don't know what 2021 will look like, but we're anticipating that we will have a year's buffet. When I say we, I mean the health exchange and the insurance administration believe that we'll have 1 year buffer, but we don't know what the federal funds are going forward.
okay. Thank you for that. Delegate Morgan.
Thank you, Madam Chair. Deputy Collison, do we know how much money comes out of that reinsurance fund per year?
Sure. I can tell you in 2019, it was 353 million. In 2020, it was 400 million. And in thus what we're expecting, or what they're expecting in this year, is 335 million.
335 million.
Yeah.
Okay.
So you have at least, I guess the average would be somewhere around 360 million comes out of that fund a year.
Right.
How much do the carriers pay into it?
Well,
If it's
they're 1%, right? So in
It would be
2020, the
200.
carriers contribute 118 million.
Okay, and the rest of the federal dollars.
Right, the rest are federal dollars. And in 2021, it was 124 million.
Okay, gotcha. Thank you for that information.
Delegate Bendari.
Thank you, Madam Chair. If I understood correctly, the subcommittee chair and delegate coalition, the state reinsurance program was created through bipartisan legislation signed by Governor Hogan in 2018, correct? When after several years of increasing premium rates for individual health insurance, market went high. And now this bill will help ensure the long-term stability of our health insurance market by extending that SRP, the state reinsurance program funding source, through 2028. Did I understand this correctly?
Yes, delegate. And I would also suggest, though, we are extending it. But during that extension, we also have time to consider other ways to fund it, to look at whether or not the assessments are right. You know, we have time to look at it, but as long as we know it's in place, then it will be security for us at least for the next 5 years.
Thank you. Therefore, I'm voting green on this.
Okay, but we'll start with the amendment. So know that it's the amendment we'll be voting on first. Is that Delegate Saab's hand up?
Yeah, I actually just thought of something, and I think it's in the bill. And Delegate Carlson, since you know this bill inside out, you probably can answer this question. So an average we take in is about $360 million a year. So that means about $3.6 million this 1% is paying, correct?
I'm not sure I understand. So we are using,
So the 1%.
I know how much the carriers are paying in. And they're paying in an average somewhere like 120 million a year.
Okay,
That's
so
what
what,
they're-
I guess my question is, the 1%, what does that equate to dollar-wise?
Well, the 1% in 2020 was 118 million. And in 2021, it was 124 million.
Or
So
are
how-
you asking what it equates to in a premium?
Oh, in a premium.
No,
No, I'm
Well, not in
asking
a
what she's
premium.
asking. Are you asking premium or are you asking the money that is in aggregate?
the money that's in aggregate. So if this 1% wasn't there, how much less would go into that? I guess that's another way to
Well-
ask it.
Well, I can say there would be no federal money because we have to have state money in order to have state commitment in order to have the federal pass-through money. So there wouldn't be, if this 1% wasn't there, there's no money. If you want to know what's left, there's no money coming in. Right now, going forward, if the projections for 2021 are correct, they'll be close to $500 million in it at the end of 2022. And so the question is, but if there are no state dollars contributed, then there'll be no federal dollars. And we don't know what the federal pass-through money will be next year. Does that answer your question, Delegate?
Yeah, I'm just trying to figure out if we didn't do the 1%. You said there'll be less money, but I'm thinking, so if it's $1,500 a month, let's say the average member that's paying, so that's $15. So if they didn't pay that, I'm just trying to figure out if we didn't do it. I understand the federal money part of it. So I guess what's more important is the federal money part of it more than just the 1% premium, because that's a tax on the premium, or that's a fee on the premium.
Right.
That's paid monthly.
Right. And it
So-
ends up, like I said, being about 120 million. And in our 3 years of experience, we need about 360 million a year.
And what is the size of that market? The whole big bulk, like the annual collection, I guess, the annual premium collection. Do we know that? Well, I guess it would be 120 million. No,
Right.
120, it would be 1.2
Yeah.
billion.
Yeah.
Because that's 1%. Okay, all right, thank you.
Okay.
Yeah.
It's a lot of math for this time of day for me.
Sure is. Sure is. Delegate Morgan.
Thank you, Madam Chair. I think we got it now. I mean, basically, you got to put some money in to get the money back from the Fed, and that's where we're trying to really get at. I think the majority of, or I know at least I am, I think where we're really stuck is the tax increase on the small group market. We have an all-payer system, so some of us believe that the tax base should be broad. I would think that this money should be able to come out of the general fund instead of, on the backs of other ratepayers. I think would make a lot more sense. If we're going to have an all-model system, you need a broad tax base. I think that's where we're hung up at. But
And
yeah,
that's something
I'll tell you
that,
what, Delegate Kellison's done a great job because we beat the hell out of this bill in subcommittee. She is floor ready.
I'm gonna say
I
that-
thank you all for the practice.
Yeah, and I would say that, you can define something many different ways. I see a tax increase increasing what's there now. We're not doing that. What we're doing here is we're maintaining a fee or a tax that is paid by the insurers. We're not raising it from what it was last year or for the last 5 years. We're maintaining it. But that would be my parsing of the phrase, and you might have a different parsing, and I respect that. This is an administration bill. The governor has put it forward, and as Kiefer Mitchell said to me when he thanked me for seeming to be supportive of this bill and helping the governor, I said, "You're welcome." Sometimes he comes up with a good idea, and Kiefer said, "Even a blind squirrel finds a nut from time to time," and I'm okay with that. So this to me is a bipartisan issue. It comes from the governor, and the General Assembly is giving it due consideration. Delegate Shalega, did you have something to add?
Yeah, I wanted to say what you said reminded me of something Ronald Reagan said about how hard it is to kill a government program.
Is there more to that quote?
No, I was just,
Okay.
injecting a little Ronald Reagan humor. Sorry.
Okay, no, I just don't get it, but that's okay. I often don't get things, and mostly when I make a joke, nobody gets it. So it's all fair. Thank you, Delegate Shalega. With that, we are voting on the amendment that gives a credit to the vision and dental plans to keep them whole.
And the study language.
And the study language, which, what does it say, Delegate Cullison, exactly? Do you recall?
That the MIA and the Maryland Health Exchange will study the impact of the reinsurance program on premiums on the healthcare market and consider options for other ways to finance it.
And have they been very helpful in this process in terms of supplying data when asked?
Absolutely. Both agencies have been terrific in working with me and providing information and helping me to understand that whole notion of pass-through. So,
which in and of itself is a lovely development, because as we know, there are some departments who are less responsive and less helpful in developing policy. So I would like to say thank you for that. With that, you know what you're voting on. All those in favor of the amendment, please say aye. All those opposed, please raise your hand in the panel. I see no hands in the panel, so that amendment passes unanimously.
so I'd like to move the bill as amended.
No, wait.
No.
That's right. Yeah, I'd like to move the second amendment, which removes sponsors from the bill.
Is there a second, Delegate Krebs?
Yeah.
Thank you for reminding us.
Second.
All those in favor of this amendment, or is there discussion? All those in favor, please say aye, and all those opposed, please raise your hand in the panel. That vote is unanimous. Delegate Cullison?
I'd like to move the bill as amended, please.
Is there a second? Thank you. Is there discussion on the bill as amended, or do we feel like maybe we've gotten through that adequately? Okay, everyone's questions have been answered. All those in favor?
Delegate Sid,
Delegate
Saab.
I actually wanted to clarify. So who's the blind squirrel in that quote?
I think according to, why don't you ask Kiefer Mitchell? How's that?
I will do that.
Okay. All those in favor, please say aye. All those opposed, please raise your hand in the panel. I see Delegate Shalega, Delegate Morgan, Delegate Kipke, Delegate Riley, Delegate Krebs, Delegate Saab, and Delegate Chisholm. That's 7. Do you see 7, Richard? Do you have 7 names?
Wait, I want to be on there.
What? I
see. So,
was that
I think Delegate Lewis wants to vote against it.
Well, Delegate Lewis, did I hear you say something? Delegate Lewis, are you still with us?
I was having trouble with my sound.
Okay, you are a yes. I don't see a hand in the panel, correct?
Is that yes to be?
That's yes in favor of passing the bill.
Yes, ma'am.
Okay,
So
no
no hand.
no hand, that's correct. We have 7 opposed and the rest of the body in favor. Okay, that bill passes. We will now move on to House Bill 5.
Chairman, I hate to do this and I have never done this, but there's always a first. House Bill 370, I know we voted the bill. It was not unanimous, and Delegate Belcastro and some of the advocates have a question about the bill. And is it possible to hold it so that it's not reported? Or do I need to make a motion and we vote on it to recommit it to subcommittee to look at it, at the wording? There's some confusion, and it's not Aaron's fault. This is not Aaron's fault. This is, my fault.
Yeah, I truthfully don't know the answer to your question. Once a bill has been voted, it's been voted. Aaron, do you have any information procedurally of how?
I don't know. This is new and I can't do the research in time to advise you correctly. I think if you don't report it, then you have a duty to get it to the floor in a certain amount of days. But if you don't report,
But I think once we voted it, and we did, then we have that.
you voted it, you haven't reported it yet, though.
I think Delegate Karen Lewis has an idea on this.
If we're following Robert's rules, then if we're reconsidering the same day, we can do that. We can reconsider.
I don't know why.
We can
I
provide
think, Madam Chairman, I
Sorry,
think
my
you're
phone
correct.
is blowing up with text and I don't know why. And I really need to shut this whole thing off and stop making noise. I apologize to the body. I'm just figuring out how to shut it off. Okay, now I'm going to stop distracting everyone. And again,
I think Delegate Pendergrass
Yes.
is Chairman, you're correct. Once I think, because it's been moved and seconded and then voted, I don't think you can take it. It's just from my experience, and I don't know, I could be wrong. You've been here longer than me, but I think once it's voted, it's done.
Well, you can do a motion to reconsider, but it has to be approved by a majority of the voters, the committee.
Those of us voting.
And I
Was
think
that
we could,
Delegate Landis contributing?
Hello?
Delegate Kaiser
meetings.
I'm sorry, who was that who provided that information, which may very well be true? I'm just interested.
About the motion to reconsider?
That was Delegate
Yes.
Landis.
Okay,
Yeah.
thank you.
Who said what I just said, and the
I heard
reconsider
Yes.
motion can be made by someone who voted for it.
With the majority, correct.
On the prevailing side.
Yeah.
Right.
Yeah, that's what I mean by the majority. Thank you. That's right. And you know what? I know that from the floor votes. So I know that that's part of our rules now that you bring it up. Thank you, Delegate, both of you, Lewis and Landis. I really appreciate your reminding us of the rules that we generally follow on the floor, which I believe we follow, although I don't remember ever having done it. So with that, Delegate, let me start by, did we take the roll on the last bill?
Yes.
Richard, did we get all that done?
Yeah.
Yes.
Okay. Okay, so Delegate Pena-Melnick, do you want to make a motion to reconsider our vote?
Yes, I would like to make a motion to reconsider our vote and move House Bill 370 back to subcommittee.
Second.
Okay. Is there discussion? All those in favor of the motion,
Matt has
please.
his hand up for discussion.
Yeah,
Vote Morgan.
I'm sorry, Madam Chair. Now, did we all vote on it or
Everybody votes.
just the majority of the people that voted?
No, everybody in the body votes.
Thanks.
Okay. So with that, all those in favor of allowing this to be recommitted to subcommittee, please say aye, and all those opposed, please raise your hand in the panel.
Aye.
Aye.
I see no hands in the panel. We will recommit this bill to subcommittee and it will come up again at our next voting session.
Thank you so much. I really appreciate the body's consideration, okay? Thank you.
And I appreciate the body helping me remember the rules so that we got it right. So thank you to my two expert advisors. I really do appreciate that. Okay, so
Madam Chairman, can we
Yes.
just, in the meantime, maybe have Lisa and Aaron just make sure that we followed the rules correctly?
we can.
I'm not
we
doubting,
did.
but just in
Yeah.
case, just to verify.
That's fine. I'm happy to do it, but we did. I sometimes I just have to be reminded of something I haven't seen since last year or the year before. We've never done it in committee, it's true, but it is the rules we follow. So, but somebody in staff, please go check. And if we made a mistake, well, we'll fix it in whatever best way we can. But I thank everybody for trying to make things work. The next bill is House Bill 534. Aaron.
This bill requires Medicaid to provide coverage for self-measured blood pressure monitoring for all Medicaid recipients diagnosed with uncontrolled high blood pressure. Coverage must include the provision of validated home blood pressure monitors and reimbursement of healthcare provider and other staff time used for patient training, transmission of blood pressure data, interpretation of blood pressure readings and reporting, and delivery of co-interventions. There are no amendments.
Delegate Penny-Melnick.
Thank you, Madam Chairman. The vote was unanimous in committee. And there are no amendments. I move the bill.
Second.
Is there discussion on this bill? Seeing none, all those in favor say aye. All those opposed, no. No,
Aye.
raise your hand. Looks like the vote is unanimous. The bill passes. House Bill 578. Aaron?
As amended, House Bill 578, and there's an amendment of this bill on pages 13 to 15 of your packet. As amended, the bill would require MDH to adopt a reporting system to monitor the prescribing of medications to treat opioid use disorders, analyze prescribing patterns to identify prescribers who regularly prescribe non-preferred medications, conduct outreach to individuals authorized to prescribe using educational materials regarding the benefits of prescribing preferred medications, and identify barriers to individuals who need medication to treat an opioid use disorder to obtaining the medication in a timely manner. The department is required to provide an annual report to the Governor and General Assembly on its findings and its actions taken under the bill.
Thank you, Chairman, and thank you, Aaron. We discussed this bill. We actually had it in subcommittee for 2 weeks, 2 days, and we basically met with the department with Trisha Rowdy and Mr. Athos, and they talked to us about the rebate that they generate from the brand new drugs and the generics. And they met, and this was a compromise, what you have here, this amendment. Basically, the department is supporting it, and they supported the language. They helped draft the language. And this is a good way so that we know really what is the reality when you look at this issue, and that they can report and we can see how we can work on it without losing money, as the department says they will lose money. So we don't want them to lose money. So we're going to do it slowly, and we work with them on the language. I move the amendment.
Second.
Is there discussion on House Bill 578? On the amendment, excuse me. All those in favor say aye. All those opposed, please raise your hand in the panel. I see no no's, so this amendment passes unanimously.
I move the bill thank you for doing that.
Is there a second?
Second.
Is there discussion on the bill? All those in favor say aye. All those opposed, no.
I'd like to be a
Raise your
co-sponsor.
hand in the panel. Seeing none, this bill passes unanimously. We will move on to House Bill 588.
Madam
Yes.
Chairman.
Madam Chairman,
I don't,
I think there's some desires for some co-sponsors on that one, since it's a pretty Good bill.
Okay, and there's an amendment, so we can do that.
Thank
So
you.
who would not like to be a co-sponsor of that bill? Seeing no hands in the panel, seeing no hands on my screen, we will all be co-sponsors of Delegate Banderi's bill. Okay, thank you for bringing that up. House Bill 588, Aaron.
This bill requires 3 specified community action agencies in collaboration with the appropriate local health department to make feminine hygiene products available at no cost in an amount sufficient to meet the needs of the woman obtaining the products. For fiscal years 2024, 2025, and 2026, the governor must include in the annual budget bill funding in an amount estimated to be sufficient for the providing feminine hygiene products as required under the bill. The bill will sunset on September 30th, 2027.
Yes, thank you. Thank you. Erin, can you remind us what the 3 locations are, please?
Yes.
Thank you. Because I know that question is going to come.
Yeah, they are Southern Maryland Tri-County Community Action Committee, United Communications Against Poverty, and Community Assistance Network.
Thank you, Erin. I appreciate it. Chairman, we discussed this bill. The vote was unanimous. The 3 CAAs agreed to do it. The bill is limited in scope, and the Maryland Department of Health supports the bill as we have it in front of us. And I actually move the amendments.
Is there a second?
Second.
Discussion? I see Delegate Chisholm's hand is up.
Madam Chair, I apologize, but I just want to, I hate to go back, but I'm going to try to clear up some confusion. We all
Is this on this bill or another bill?
well, I think a lot of people are confused because all of us just co-sponsored Kaiser's bill, not Delegate Bandari. So some people think
That's
we're on
correct.
the wrong bill.
I thought we could sponsor Delegate Bandari's bill.
No, I did not have any amendment on my bill.
Oh,
HB 578 was Delegate Kaiser's, which we all co-sponsored.
Yes.
I wrote down the co-sponsors to go to 578.
Okay, thank
right.
you.
We're going to have the amendment because I made a mistake and we're just going to do it. Is that right, Aaron? We can do that?
We have an amendment. Thank you.
Yeah,
Delegate
the
Chisholm.
co-sponsors will all go on 578.
Okay, good. Thank you for clarifying that. I really do appreciate it.
Thank you.
We like to get these things right.
Thank you.
And sometimes I don't. Where are we? Delegate Krebs has a hand up.
Thank you, Madam Chair. With the amendments, is this a pilot or are these just the health departments that want to take part in this and they're going to pay for it?
They're going to take part in it. They're going to pay for it, but this has a sunset. So it terminates. It's a 5-year sunset.
So then what's the expectation after the sunset?
Done.
The expectation, I know what I have in front of me, that it's going to be done. They'll see if it works. They are willing to pay for it. The Department of Health is supporting it. Hopefully, if it works, they'll continue to do it. But the bill in front of you only does it for 5 years.
But the bill would have to come back to us.
That's right. Right. If you wanted to continue it.
Or
and excuse me. So the local government is the ones paying for it, not the state. Is that correct?
No, it's as funded by the governor, and they only have to do it if it's funded.
Because in the bill, it says in the original bill, it said the bill imposed a mandate on local unit of local government. So I thought the original bill, the local government was going to pay for it. That's
They're amended out. They're amended out.
On page 4, line 1, it says subject to appropriations of funding in accordance with subsection C of this section. So it has been changed.
So if it gets funded, it would come out of the state budget, not the local budgets. Is that right?
That is correct. It
I'm
is
trying to follow.
funded by the governor.
And
I think Delegate Krebs was correct because I was under the same impression that it's local. the locals will pay for it.
Okay, all dogs need to be put in the hallway or mics turned off. Is the funding for the pilot program for the counties that want to be in it, is that in the amendment or isn't that in the original bill, Erin?
In the amendment is as provided by the governor in the budgets for those fiscal years. If it's not funded, then the community action agencies are not on the hook to do the programs.
And if I may, Chairman, the bill, the interlineated copy given to us on page 4, line 8 says for fiscal years 2024, 2025, 2026, the governor shall include in the annual budget bill funding in the amount estimated to be sufficient for providing feminine hygiene products as required under this subsection.
Thank you, Delegate Penny-Milnick. Did that answer your question thoroughly?
No, because at first you said it was subject to him putting it in the budget. Now you're saying it's mandated to be put in the budget. So which one is it?
But it's only for the year 2024, 2025, and 2026.
Okay, so it is, but it's not subject to if he puts it in the budget. It's a mandate on the budget for the next 3 or 5 years. Because the bill started off, local government was going to pay for it. I just trying to make sure I understand it. That's fine.
Sure. It doesn't require the governor to fund it, but there's extra protection language that says subject to the appropriation of funding. So if it's not funding, if it's not funded, the community action organization agencies are not required to do the program.
Thank you.
A cover for them if they don't get the funding.
Okay.
Madam Chairman.
I'm going to move on to Delegate Shalega, whose hand has been up.
Thank you, Madam Chair. Just to remind us, isn't this only, tell us the three, I'm looking on handwritten page 16 and 17, and it says the Southern Maryland Tri-County Community Action, United Counties Against Poverty, United Communities Against Poverty, and Community Assistant Network. What geographically tell us where these three programs are going to be?
Delegate Bagnall, you know that, correct?
They're essentially Southern Maryland, Prince George's County. They do touch. Actually, let me just grab the specific counties, because it's actually 5 counties within these 3 organizations, because they are multiple counties. So I want to make sure that I'm giving you accurate information.
We'll wait. Are you going to grab them now?
She is. Mm-hmm.
Wish I could.
While she's looking for that, Erin, the local health departments are not going to put any money into this program. It's all state funding.
Correct.
Mm-hmm. That's right.
Have you found it, Delegate Bagnall? I can't hear you, Delegate
You're
Bagnall.
muted.
Apologize, I didn't have that information in front of me, so I don't want to give you inaccurate information.
So she doesn't have it. So
If I could jump in here, I believe this is for the Tri-County Councils, and there's 4 or 5 of them throughout the state. So you mentioned
I'm going to call on Delegate Morgan. Is that Delegate Morgan who's speaking that I'm going to call on now?
Yeah, sorry. ma'am.
Delegate Morgan.
So I believe this, is this bill, I believe this was the bill for the Tri-County Councils, if I'm not mistaken.
Yes.
It deals with Meals on Wheels, is that right? Or am I getting the wrong bill?
No, this one doesn't deal with Meals on Wheels. This deals with feminine hygiene products.
Well, it's the same group putting in the bill, but we had multiple hearings.
Yeah.
So
It is, which is why the Department of Health was involved.
Right. So Tri-County Council, there's several of them around the states or in rural areas. They're set up for economic development, and basically it's a pass-through and grant organizations for the state. So they dabble in this healthcare initiatives from a regional perspective.
I have the answer if you would like it.
Okay.
We'd all like it, Delegate.
Sorry, that took me
Okay.
a moment. The Southern Maryland Tri-County Community Action Committee is, sorry, just went off my screen. Calvert, Charles, and St. Mary's. United Against Poverty is Prince George's, and Community Association Network is Baltimore County.
County or city?
County.
Okay, is that adequately answered? If so, I'm going to move on to Delegate Saab, whose hand is raised. Delegate Saab.
Thank you, Madam Chairman. So what is the fiscal note now?
I don't think we get revised fiscal notes. You can assume it's smaller than it was when it was statewide by a lot.
Because it is limited in scope.
Yeah, so originally it spoke to 17 community action agencies. Now you're down to 3.
And how much was I'm sorry, what was
there wasn't a determined amount.
So we never knew that what the fiscal note before or now. I mean, you can do the math. So I'm still confused because at one point you said the governor shall, and then another point says he does. If there's no money, there's no money. So if it's shall, shouldn't the money be there? It's a mandate.
It should, but if it's not, the CAAs are not on the hook to do the program.
If the legislature were to remove it, which of course we have the power to do, then it would not be in the budget. I assume that that is what it's addressing. I don't know that, but it would make sense. Okay.
Thank you.
You're welcome. Delegate Krebs.
I'm sorry, I'm just looking back at the original bill, and the original bill required a local health department to make available at no cost feminine hygiene products to any woman enrolled in Medicaid, and it was for everybody. Local health departments. And now we've got it down to, we're doing it for a certain amount of years. And it's only
5
in certain
years.
areas. So I guess my question is, I mean, what's the end goal here? And why are certain areas getting it and not everybody getting it? If the state taxpayers are paying for it, it seems like it should be, it's not a pilot to figure out how it works. Like what's the goal of this, except to give a couple of communities that aren't even necessarily our poorest communities, why, and the state's paying for it, what's the end goal here?
Delegate Pena-Melnick.
I'm going to let Delegate Bagnall, and then after Delegate Bagnall, I'll speak. Go ahead, Delegate Bagnall, if that's okay with the chairman.
Yep.
Since she negotiated it down from 17 to 3.
So Delegate Krebs, you are correct. Ideally, this is a pilot to find out if this is a workable program across the state. However, the words pilot and program change where this is in the code. They actually change the process. And the reason that we chose these 3 community action agencies was at the recommendation of the agencies who said these were the agencies that were best equipped to start the process of allocating these products. They also touched a number of communities, including urban and rural communities. And the reason that the local health departments were amended out in collaboration is because the local health departments, although they are in support of this effort, because of the pandemic and because of how the administrative burden they already have and their lack of storage, the implementation didn't make sense for it to come through the local health departments, but rather through the community action agencies. The health department, the Maryland State Health Department, wanted to work in cooperation with MCAP, which is the Maryland Community Action Partnership, on the implementation plan and rollout. So we really limited this to make sure that we were going to be able to reach our low income communities, but in a way that we could figure out the best way to make it work, because there
I
isn't
appreciate that.
really a model.
I mean, we have people in need in our county too. This goes on. I don't know why it takes 3 years to figure out if handing out free feminine hygiene products works. I just think we pick winners and losers, and the state taxpayers are paying for it, and they don't have any skin in the game. So I'm going to vote against it just because I don't know how these people got picked. You know, we've got low income folks that have the same needs as well. So I'm not sure what the end game is here. Just picking a pilot for distributing free products to a select place in the county, in the state.
And if I may, the end game here is that this is an issue. A lot of women cannot afford to buy their pads. They cannot. It's expensive. And when they get SNAP doesn't pay for it. You can go to the supermarket and buy your period, the stuff that you need for your period with your SNAP, with your coupons. And these are poor women. And it's very expensive. I know, because I buy for 2 girls. It's very expensive and it's tough to afford. So yes, we can do the 24 counties because we are limited with our budget, right? We have to be prudent. So we chose those areas where we have seen a need, and we saw it through the testimony during the hearing. There was a Miss Angela Martin who testified. She's with the Maryland Community Action Partnership, and she served as a voice for the community action agencies across the state. And she said that their main goal was to eliminate barriers to economic security, and that they have seen that this is a financial burden to women experiencing poverty. The research shows that 2 out of 3 women with low income cannot afford their menstrual product in the last year, or had to choose between those products and buying food. So that is basically, the testimony was pretty impactful. I would love to do it for all 24, but we knew that it will have a big fiscal note. It started with 17, it's down to 3. And it's unfortunate that we today have to talk about a bill like this, but many people cannot afford it. Thank you, Madam
Okay.
Chairman.
Thank you. I see Delegate Banderi's hand and Delegate Johnson's hands.
Thank you, Madam Chair. If I understand this bill correctly, the end goal of this bill is to make feminine hygiene products available free of charge to Medicaid recipient. And the financial impact we discussed a lot would be mitigated by the decreased amount of Medicaid dollars spent on entirely preventable infections that we cannot forget, caused by lack of adequate access to this basic need. Did I understand this bill correctly, Delegate Bagnall?
Yes.
Thank you.
Thank you, Delegate Johnson.
Thank you, Madam Chairman. If this is going to be a pilot and we're considering doing this across the state, would it not then make sense in that pilot to take samples of different types of areas around the state?
Well, this is what the bill does. It takes those 3 areas, which is basically the counties that the delegate stated: Calvert County, St. Mary's, Baltimore County, and Prince George's, which are very different counties in their different areas.
That was my point in the question. Thank you, Madam Chairman.
My pleasure.
Thank you, delegates. I see no further hands. So I believe we're voting on the amendment at this time.
You
Am
have
I
one
correct?
hand up.
What?
Delegate
Oh,
Hill.
Delegate Hill.
Yeah, I'm slow. I just wanted to make sure, Madam Chair, Madam Keenan Melnick, the idea here is not letting the perfect be the enemy of the good, right? You got to
That's
start
correct.
somewhere. Okay, thank you.
All right. All those in favor of the amendment, please say aye. All those opposed, no. Please raise your hand. I see no hands in the panel. The amendment passes unanimously.
I move the bill as amended, Chairman.
Second.
Is there a second?
Second.
Second.
Thank you. Moved and seconded. Is there discussion on the bill as amended? I see a hand. Delegate Saab.
I mean, I would just, Delegate Penny Manley brought something up. So if SNAP doesn't pay for it, wouldn't it have been easier? I know this is, I guess, for a different bill, but why hasn't anybody put in a bill to make SNAP pay for that?
Because
And
that's
we
federal
wouldn't have the
money.
problem.
It's federal money and there's a federal bill that has not passed. So that's why
Thank you.
states are taking it into their own hands. Thank you for the question.
Thank you.
My pleasure.
Is there any further discussion? All those in favor of the bill as amended, please say aye. All those opposed, please raise your hand in the panel. Opposed, I see delegates Morgan, Krebs, Chisholm, Shalega, Riley. Did I miss anyone? Okay, I think that was 5.
Sponsor amendment.
We can, there's an amendment on this bill. Who would like to be, well, let's do the usual. Is there anyone who would not like to be a sponsor of this bill? And I'm sure I'm going to see.
Besides the people who didn't vote for it, I would assume.
Well, I'd like to see their hands in the panel anyway. You might as well give me all of them so I don't make a mistake counting people not thinking of them. So I see delegate, wait, let me get rid of this chat thing, and that's what's getting in my way. Okay, I see Delegate Kipke, Delegate Krebs, Delegate Shalega, Delegate Chisholm, Delegate Morgan, Delegate Riley. Those are the people who will not be included as sponsors.
Madam Chairman, I don't want to be a sponsor.
Did I miss you? I apologize, Delegate
Yeah.
Saab. Please, also Delegate Saab. Have we got everyone, Richard?
Got it.
Okay, good. Thank you. With that, the bill passes and many of us are sponsors and some of us are not. Next, I have
Oh my God.
House Bill 609. Aaron.
House Bill 609 repeals the provision that specifies that the health officer for a county serves at the pleasure of the governing body of that county and the Secretary of Health, and instead enumerates specific reasons for which a health officer may be removed from office with the concurrence of the governing body of the appropriate county and the secretary. The bill requires the secretary to provide written notification of removal to a health officer and authorizes the health officer to appeal a removal decision to the secretary and the Office of Administrative Hearings. There is an amendment on pages 18 and 19 of your packet that clarifies, for purposes of the state personnel and pensions article, that a local health officer does not serve at the pleasure of their appointing authority.
Okay, before we talk about the amendment that we have in front of us, Delegate Saab asked me if we could hold this bill. So Delegate Saab, would you like to hold this bill? Delegate Saab?
Yes, ma'am. Yes, ma'am. Yes, thank you. I appreciate it.
Okay, we allow a member, unless we're at the point where we can't allow it, a member to hold a bill till the next voting session for the purpose of an amendment or clarification. And so we will do that. It will be on the voting list next time we vote, which will be before Friday, just so you know. We're going to be voting numerous times next week, as is customary during crossover week, because everyone wants their bills out. Okay, so that bill is.
Chair, I have a question.
Well, I think that, could you hold, is it about the bill?
Yes.
Let's hold it until we discuss the bill in our next voting session. Okay?
Well, I'd like to discuss it before that, because we were supposed to, Jocelyn and I are working on 2 bills together, and this was supposed to be discussed with, and we just had a meeting last week about it. And I want to make sure we get together before the next voting section to discuss I call it companion bill, that I've had in, and I've been waiting to get together to discuss it. And I was surprised to see this on here because we haven't talked about the other bill.
So this bill is very different from your bill. They're different subject matters. And on your bill, we held a meeting when we were actually voting last week, but they all met, the health officer with one of my interns. We have a we actually sent you, I don't know if you've seen your email, today you got a memo of the meeting in details of what happened and what the proposal is regarding due process and notice for your bill and what the health officers are proposing to do. So it's all in the memo that we sent you. And you and I, after you got it, I would like to speak with you on Monday so that we can discuss what's in that memo, which is very clear of some proposals that they have, that there may not be a bill necessary because they're willing to do certain things. So if you could take the weekend to read it and then meet with me on Monday, we can discuss
Well,
it.
I would just like to mention, we all, Madam Chair, we all think our bills are important.
Yes.
This is like my most important bill this year, and I've done a lot of homework on it, and it relates to this bill because they don't have any accountability to anyone in law. And I just would I'd like, that meeting last week occurred while we were voting, and I was not able to participate because I was focused on voting. So I just would like everyone to realize all these bills are important. This is the one that's important to me this year, the one that we haven't talked about yet. So just for the record, we all do have passions about things, and this is mine this year, and somehow.
We do, Delegate Krebs, but this is completely out of order because we're having a voting session and we're discussing bills that are before us, not bills that are not
But
before.
we agreed in our last voting session to work on this together, and we didn't even talk about it, and it's back on the voting list. That's all
I
I'm
don't
trying to
believe
say.
I agreed to anything.
Yeah, not on this, not
Not
on
in
the
the
voting
voting
list.
session we
But
did.
just for the record, so that we're,
No, no more.
okay.
This is out of order entirely, and we are going to end the discussion and move back to our voting list. And I'm sure that the vice chairman will work with you. But we're now moving on to House Bill 684. Aaron.
This bill prohibits the Maryland Department of Health from limiting or restricting admission of a Medicaid recipient for inpatient care at a special psychiatric hospital or an acute general care hospital with separately identified inpatient psychiatric service unless MDH bases the limit or restriction on the medical necessity of the admission and establishes the limit or restriction through regulation. This bill was in the full committee voting session last week, and it was held pending a report requirement. There is a reporting requirement on page 20 of your amendment packet. This report would require MDH to provide an annual report to HGO and the Senate Finance Committee on the average length of stay for Medicaid recipients for Institute of Mental Disease Services as reported to CMS, any corrective actions plans and any limits on days of stay required by CMS, any federal funding withheld and any additional state funding required due to the requirements of the bill, data on the effect of the bill's requirements on length of emergency department stays, and data on whether Medicaid recipients receiving IMD services were transferred to another facility and the type of facility to which they were transferred. This amendment was reviewed by MDH, and they were okay with the report and felt that they could comply with the requirements of the report.
Delegate Penny-Melnick.
Last time we were here and we voted, I believe it was Delegate Shalagan, forgive me if I'm not thinking properly, but I think so. They requested a reporting amendment, and this is what this amendment does. So we brought it back. We discussed this bill in subcommittee, and the vote was unanimous when we voted the bill out. The bill now has what was requested, and I believe other people did bring up the need for this reporting. So I move the amendment.
Is there a second?
Second.
Second.
Is there discussion? All those in favor say aye. All those opposed, no. Please raise your hands in the panel. I see no hands. The amendment passes unanimously.
Move the bill as amended.
Is there a second?
Second.
Is there any discussion? All those in favor say aye. All those opposed, no. Please raise your hand. I see no hands. This bill passes unanimously. We're on House Bill 906. Aaron?
This bill alters provisions relating to health equity resource communities. The bill requires the Chesapeake Regional Information System for our patients, which is CRISP, to provide technical assistance to the Maryland Community Health Resources Commission in implementing health equity resource communities. The date by which the CHRC must issue a request for proposals to designate health equity resource communities is delayed from October 1st, 2022 to October 1st, 2023. The bill also expands the purpose of the Health Equity Resource Community Reserve Fund to include funding 2 full-time community health resource staff positions and the costs incurred by CRISP in providing technical assistance to the commission. There is an amendment in your packet that authorizes the Health Equity Resource Community Reserve Fund to be used to fund 1 full-time staff position for purposes of implementing perks and authorizes continuous funding for CRISP to provide technical assistance.
Delegate Penny-Melnick.
Thank you. This bill was discussed in committee. It passed unanimous. Last year, we passed legislation basically for the pathway to health equity grants. 9 grantees received money. And this bill basically gives them more flexibility, as Aaron just discussed. Move the amendments.
Is there a second? Is there any discussion on the amendment? Hearing none, all those in favor say aye. All those opposed, no. Please raise your hands.
Chairman, I believe
Oh, I see
Delegate
it.
Bandari has his hand up.
I see it. I missed it originally. Delegate Bandari, you have a question.
Yes, I would like to be a co-sponsor of Delegate Bagnall's 684 bill since there is an amendment.
Not right now.
Okay.
We're on House Bill 906 right now, and we need to get through that bill. Are there any other questions? Okay, all those in favor say aye. All those opposed, no. The ayes have it. The bill passes unanimously. Okay, House Bill, we'll come back to that, Delegate Barry. House Bill 972. Lisa.
This bill exempts continuing care at home agreements from certificate of need requirements by altering the definition of healthcare facilities for the purpose of providing an exception to the requirement for a certificate of need. There are amendments on page 23 that alter the certification qualifications for providers of continuing care at home services by exempting providers from the pre-sale requirement if the providers satisfy the reserve requirement and either hold in escrow all entrance fees or maintain $1 million in security until the provider breaks even.
Delegate Kelly.
Thank you, Madam Chairman. I'm going to do my best to explain this to everybody in a clear way. I know that we are all exhausted. This is the first of 2 bills you're going to hear in a row that have to do with supporting our community members in aging in place. We know that 90% of seniors want to age in place. So this bill, which was suggested by the Healthcare Commission, deals with the fact that we have these continuing care retirement communities. About half of them are exempted from the certificate of need for nursing home beds. They just have 2 different business models. Some of them go through the certificate of need process, some of them do not. Those CCRCs that are exempted from the certificate of need process for their nursing home beds have been inhibited from doing the CCRC at home model, which allows them to go in the community and provide services to folks who are aging in place and then guarantee them access to the nursing home should they need that. So this legislation initially would just address that issue, which was important and supported by all the stakeholders in the industry. The amendment came up as we were discussing the bill. It was determined that there's another barrier in place to the continuing care at home model, which has to do with the pre-sale requirement. We were the only state that had this pre-sale requirement. There was a company that was looking at working in Maryland and then chose not to come to Maryland because of this requirement, which is onerous. Secretary Kramer was very supportive of shifting the requirement so that instead of having a pre-sale requirement, we're shifting it to having $1 million in cash or bond instead. So everyone was in agreement with the amendment as well. We think that this is going to help those seniors who would like to participate in a continuing care at home model have access to that type of model here in Maryland. It passed the subcommittee unanimously. I move the amendment.
Second.
Is there action on the amendment? Seeing no hands, all those in favor, please say aye. Have it, it's unanimous. Somebody want to move the bill? Oh,
So
wait,
moved.
a hand. I see a hand. It's a little oddly late. Delegate Johnson.
Yeah, I'm dragging a little bit this time of night, Madam Chairman.
We all are,
Um,
Delegate
I
Johnson.
just wanted to be clear on, now, this is exempting the nursing homes that fall under the certificate of need. This is exempting them from the certificate of need. Is that correct?
No, if you're operating a continuing care retirement community that already has their nursing home exempted from the certificate of need, it's about half the CCRCs, they're going to be able to not only allow the residents who live in the assisted living facility, but also the folks participating in the continuing care at home model to transition into the nursing care if necessary.
Gotcha. Thank you. Thank you, Madam Chairman.
I believe we voted the amendment unanimously. Am I correct? And we're now on to the bill, Delegate Kelly.
Yes, ma'am. But it just looks like Delegate Schlega has a question.
Delegate
Move
Schlega.
the bill as amended.
Let's have the bill as an amended. Is there a second?
Second.
Delegate Schlega, do you have a question on the bill?
Yeah, I just wanted to say, this is a great program. If you want to know more about it, it's on the Department of Aging Communities for Life program, and it will expand that program. And so I think it's great. If you have any, it is a little complicated, like Delegate Kelly said, but also I would like to be a co-sponsor when we get to that point, since my mic is off of mute. Thank you.
And the good news is there's an amendment, so we can all do that. Thank you. Is there any further discussion? All those in favor say aye. All those opposed, no. The ayes have it, and it appears to be unanimous. It is unanimous. Is there anyone who would not like to co-sponsor this bill? This bill will be co-sponsored by the entire committee minus the person who is not here tonight, who has a good reason, but she can't vote because she's not here. With that, we'll move on, and I still haven't forgotten you, Delegate Benderi, but I may yet, so make sure you remind me when we get to the end of the voting list. House Bill 1051. Lisa.
This bill establishes a Howard County and Montgomery County Adult Day Healthcare Services pilot program to integrate the provision of medical adult daycare, home health care, and medical services provided under Medicaid. Howard and Montgomery counties may jointly designate and authorize the operation of one or more entities to serve as an integrator and coordinate all services provided under the pilot program. The bill also establishes a task force on the Howard County and Montgomery County Adult Day Healthcare Services pilot program. The two counties will jointly staff the task force and report back by October 1st of each year. There is an amendment on page 26. It adds a member of the Alzheimer's Association to the task force. It requires the task force to make recommendations on implementing the pilot program statewide, and it requires the task force to compare the pilot program to the program for all-inclusive care of the elderly.
Delegate Kelly.
Thank you. This is another bill that did pass out of the subcommittee unanimously, with the amendment passed also unanimously. By way of background, the reason, I know this question will come up, the reason the pilot is in Howard and Montgomery County is that the company, which is called Savita Health, that is coordinating with us on the pilot, is located in Howard and Montgomery County, and they're absorbing a lot of costs to do this pilot. So Montgomery County is paying for the staff person. Savita Health is absorbing the costs to do a pilot program that's going to look at how we can defragment delivery of care, and also potentially reduce 911 calls from elderly individuals who are at home. It's a really exciting pilot, and I'm excited that the state is going to be able to partner with them. And I thank Delegate Krebs for her amendment, looking at how we can better implement it statewide. We're adding the Alzheimer's Association as well, and making sure we understand the differences between this and the PACE program, which is similar but does have limited enrollment. So that's what the amendments do, and I move the amendments.
Second.
Is there any further discussion? Seeing none, all those in favor of the amendment say aye. All those opposed, no. I see no hands. The ayes have it. It's unanimous.
The bill is amended.
Second.
Is there any discussion on the amended bill? All those in favor say aye. All those opposed, no. The ayes have it. It's unanimous. I don't hear anything about co-sponsors. Do we
Sponsor amendment, Madam Chair.
Yeah.
Okay, is there anyone who doesn't want to be a co-sponsor? Anyone who does not want to? Delegate Krebs, do you not want to be? Your hand.
No, ma'am.
Delegate Kipke's hand is up. Oh, I see a number of hands. Okay. Kipke, Krebs, Riley, Morgan, Chisholm, Shalega, Saab. Got it all? Didn't miss anyone? Okay, you will not be a co-sponsor of this bill. Okay, House Bill 1080. Delegate, Aaron.
House Bill 1080 requires Medicaid, subject to limitations of the state budget, to provide comprehensive medical care and other healthcare services to non-citizen pregnant women who would be eligible for Medicaid but for their immigration status, and to their children up to the age of 1. MDH must apply for a waiver from CMS that maximizes federal funding and the individuals who would be eligible for Medicaid under the bill. There are no amendments.
Delegate Penny Melnick.
Thank you, Erin. Thank you, Chairman. We voted on this bill and it was not unanimous. There were 3 against. We discussed the bill and the need for it, and we passed it. I can get into it now, or we can move the amendment and then have the discussion. What would you like, Chairman?
I would like you to move the amendment.
There's no amendments on this bill.
Oh,
No amendments. I
Then
move the bill.
Is there a second?
Second.
Okay, I see discussion. We'll start with Delegate Krebs. No? Okay, there's no discussion. I see no hands up. All those in favor say aye. Oh, Delegate Morgan, I presume your hand is up for a question now or for discussion.
A question. Thank you, Madam Chair.
Sure.
I wanted to ask a question on the matching. I didn't think Medicaid, the federal reimbursement side would match for healthcare for people here for their non-citizens.
Delegate
So-
Penny Melnick.
So presently, the cost of labor and delivery in Maryland, the federal government, because undocumented individuals qualify for emergency Medicaid under the federal government. The matching presently is 50% from the general fund and 50% from federal fund. So when these women that have their babies go to the hospital, that is what the matching is. If we were to pass this bill, the matching will be 65 federal, 35 state. They're presently a third of all the states in the United States are doing this because it makes sense, because they're saving money. So the federal government does allow it.
Well,
And they increase the match if we do this. Is that correct?
Yes, 65 from 50 to 65.
the federal government's incentivizing this. When did that start? Do you have any idea?
I don't know when it started, Delegate, but 17 states are doing it,
Okay, gotcha.
including Virginia. And actually Virginia states that they will be saving money.
Okay, thank you.
My pleasure. Thank you for the question.
Any other questions or further discussion? Seeing none, all those in favor say aye. All those opposed, no. Please raise your hand in the panel. Okay, I see Chisholm, Morgan, Krebs, Saab, Shalega, Kipke, Riley. That's 7 to be recorded as no. We got that? Okay.
Yes, ma'am.
Thank you very much. That bill passes. House Bill 1148. Lisa.
This bill authorizes a carrier to enter into a two-sided incentive arrangement with an eligible provider and specifies what is permitted, prohibited, and required under a bonus or other incentive-based compensation program or two-sided incentive arrangement. By December 31st, 2023, and annually thereafter until 2032, the Maryland Healthcare Commission must report to Finance and HGO on the number and type of value-based arrangements entered into and related measures. The bill also provides that a healthcare practitioner or set of healthcare practitioners that accepts capitated payments, but performs no other acts considered acts of an insurance business, is not considered to be doing an insurance business in the state. There are amendments on page 27 of your packet. Amendment number 1 is technical. Amendment number 2 includes behavioral health programs in the definition of set of healthcare practitioners for purposes of allowing a behavioral health program to participate in a two-sided incentive arrangement. Amendment number 3 strikes incorrect references to eligible provider, removes the word solely from the provision prohibiting a carrier from reducing a fee schedule because of non-participation, and provides that a two-sided arrangement may not be the sole opportunity for increases in reimbursement. Amendment number 4 clarifies that the provisions regarding capitated payments apply to individual and group plans. And amendment number 5 adds to the reporting requirement inclusion of the impact of two-sided incentive arrangements on fee schedules of healthcare practitioners that are included in the target budget but are not eligible providers.
Delegate Cullison.
Getting off of mute is a good thing. So currently, our healthcare practitioners are paid by primarily through fee for service. You do the service, you bill the carrier. This bill has been brought to us by the carriers as a way to provide the opportunity for healthcare practitioners to build a robust practice by really focusing on patient outcomes, by working together with the group of practitioners and the carrier to set goals of patient outcomes. And they would be, instead of being paid fee for service, they would be given an amount of money upfront that they would be using for the activities and providing services to their patients. This bill is the product of nearly 20 meetings of stakeholders, which included different practitioners and carriers and the Maryland Insurance Administration. And they worked really hard together to come together and work through all of their disagreements. And I appreciate the work that they all have done, and I appreciate the fact that they were willing to continue to work right up through the subcommittee. And I believe with these amendments, we have 100% support from the stakeholders who are affected by this bill. So just really briefly, what the amendments do, the primary concern of our practitioners is that their fees, if they decided not to participate, and I want to emphasize that this is a voluntary program, and they were worried if they decided not to participate in it for whatever reason, that their fees would be reduced. Our amendments say that can't happen. They were also worried that if they decided not to participate, then their fees would not be increased. And our amendments addressed that issue. And in the study language, we added, and this is going to be studied for 10 years. So we'll be able to monitor, this committee, will be able to monitor the effect and impact of this program overall. And I think this gets to one of Delegate Krebs' questions around how are we looking at patient outcomes with respect to our healthcare and insurance relationships. But we added language that says we also want to look at how this affects primarily solo practitioners who would not be necessarily eligible for this kind of a program because it's really designed for a group. And if there was an impact on those solo practitioners who sometimes contract with a group. So for example, an anesthesiologist, what I have learned in my work here, often is an individual contractor and contracts with hospitals and ambulatory care centers. But that contract is between that individual and the center, not the insurance carrier. So they would continue to be able to have that level of negotiation. The dentists were concerned that they were included, felt that they might not be, that this might not work for them. We reminded them that this is voluntary and that it's not as useful for single practitioners, which many dentists are. But there are some situations where there are groups of dentists working together that may want to engage in this practice. So with that, I would move the amendments.
Is there a second?
Second.
Second.
I think I see Delegate Lewis's hand up. Do you want to discuss?
Yes, ma'am. Yes, Madam Chair. Thank you, Madam Chair. Thank you, Delegate Cullison. Can you just clarify again what you said? Because I was reading, I remember the dentists were concerned. And can you just repeat what you said about the, negotiation with the Dental Association? Are they on board now?
I would say neutral. And at least that was the impression I got from their advocate who came to our subcommittee. They, number one, would have liked to have been included in the discussions, and we're not. And the advocate was clear in his written testimony about that. They feel that dental insurance works differently than typical healthcare insurance, and so that it might not necessarily meet their needs. But we remind them it is totally voluntary, and no practitioner will be forced into this. That was the bookend kind of language that we have, and the ability for them to file a complaint with the MIA, which they currently have, but we're continuing that and emphasizing that. So an individual dentist probably it would not apply to them. It's just for solo practitioners, it's not the best way to do business. But a group of dentists might want to volunteer to participate in the two-sided arrangement, risk arrangement. And this bill would give them the opportunity if they wanted to. But again, no one is being forced to do it.
And there's thank you, Delegate Coulson. And there's a reporting requirement, so we'll see how it's going.
Right.
Okay, thank you so much. Thank you, Madam Chair.
Thank you. I see no other hands. All right, I would like to discuss this by saying that the subcommittee chair spent an enormous amount of time becoming an expert on this, and it's complicated stuff, and I am eternally grateful for her efforts on this, as well as the subcommittee, because it's dense, and I know you've worked very hard, and I thank you. Since it's my bill, I feel I owe you that thank you. With that, all those in favor of the amendment say aye. Oops, I see.
Madam Chair, there's a couple of questions, I think.
I didn't see them a minute ago. I apologize. We'll start with Delegate Hill.
Thank you. So it's not my subcommittee, and I wanted to commend the subcommittee chair and the subcommittee. This is, as the chair said, this is really hard stuff. I had to watch the Senate hearing to even understand and to get past my anxiety and angst and anger. And as the subcommittee chair has announced and explained the amendments and how the bill is protecting solo practitioners, particularly, and dentists, I just want to commend you on doing very good work, and especially with witnesses who continued to answer questions by avoiding answering the questions. So thank you.
Thank you, Delegate Hill. Delegate Saab.
Actually, I'm not a psychic, but I see a future in the insurance business for Delegate Cullison. She understands the health insurance, when it comes to the individual market, small market, doctors' contracts, providers' contracts. So I'm no psychic, but you definitely have a future in the insurance business.
MIA.
Okay. Any further discussion on the amendments? All those in favor say aye. All those opposed, no. The amendments pass unanimously.
Move the
Delegate
bill as
Cullison, would you
amended.
like to move the bill?
I would like to
Second.
move the bill as amended.
Second.
Is there any further discussion on this bill? Delegate Saab.
No discussion. I'd like to be added as a co-sponsor.
I'll tell you what, we'll do that when we're done.
Okay.
All those in favor say aye.
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 Opposed, no. The ayes have it, and it appears to be unanimous, which is a real compliment to everyone who participated in this. Who would not like to be a co-sponsor of this bill? I see no hands. Means everybody's name is going to be on this bill. Okay, that's done. That concludes the agenda, but we will now move back to Delegate Banderi's request. And what was the bill number of that bill, Delegate Banderi?
House Bill 684, Delegate Bagnall Bill.
Let me find that bill so I can remind us all what it is, including me. Why is it so
It's the
hard? There we
psychiatric
go.
inpatient.
Oh, yeah, psychiatric, yeah, inpatient care admissions. Is there anyone who does not want to be a co-sponsor on this bill? Looks up, I see Delegate Krebs, Delegate Morgan, Delegate Shalega, Delegate Riley, Delegate Kipke, Delegate Chisholm. That's 3, 5, 6. Oftentimes there are 7. Have I missed anyone? Okay. There are 6 people who will not be co-sponsors of this bill. And with that, unless you have something to add, I believe we're ready to adjourn. And I know that in our hearts, we are all ready to adjourn. Delegate Kelly.
I just would like to announce to the Health Occupations Subcommittee that our second meeting for next week, it will be scheduled. It'll be Tuesday after hearing. So we have commemorative day bills, and then Health Occupations will be right after that. And then our regular meeting time on Thursday also.
Is there anyone else who has an announcement to give people a heads up about coming schedule events? That was a good thing to do. Thank you, Delegate Kelly. Okay.
Madam Chair,
Yes, Delegate Cullison.
I will take the good delegates lead and remind the Insurance and Pharmaceutical Subcommittee, we will be meeting at a regular time on Tuesday, but we will be meeting again on Thursday. And I can't give you the exact time because it will be a rolling, I suspect, a rolling subcommittee meeting day. So watch and listen, watch your emails and texts from me and my staff, and we'll try to make sure we can get through the bills, all the bills we have. Thank you.
Delegate Rosenberg.
We are in the same position as Delegate Collison's subcommittee. I couldn't have said it better.
Delegate Penny Melnick.
We're meeting on Monday, the Public Health Subcommittee at noon, and Erin has sent the agenda already, so everyone should have their agenda with the bills listed. And we're going to be meeting on a rolling basis as well.
Delegate Shalega, do you have an announcement?
I have a question. Who's working on the cybersecurity? Is that Lindsay?
That's me, but also Lindsay for sure. She's the staff person.
Okay, great.
And Delegate Rosenberg, of course, who chairs the subcommittee.
Right. Okay, thank you.
I think there will be something coming to subcommittee that is in a better form. While you were busy doing one hearing today, I was busy with Delegate Rosenberg and Lindsay on this very issue. So you can be sure that my head is very worn out now, and my daughter from California is downstairs waiting for her mother to get done with her workday.
Hint, hint, hint.
No, you guys,
that's fine.
It's almost no one I'd rather be with than you guys.
What you doing?
Thank you. With that, I will say that your hand is not up. Is it, Delegate Landis?
no.
I see your real hand, Delegate Landis, but you're not looking to be recognized. Okay, thank you. I just wanted to make sure I didn't miss anyone. Thank you all for a very long, very hard, very productive day. And I will see you all on Monday. And with